Hi, in today's session, I'll be talking about pain during periods, also called as dysmenorrhea. So, what are the causes and why is it normal? Many people will be wondering, is it something that we have to really worry about, take treatment? It has various the type of dysmenorrhea, the type of pain a woman experiences during her period could will give an hint whether it is normal or it could be a problematic cause. So when I say pain during periods, it can be classified as three different categories. One called as spasmodic, and another called congestive dysmenorrhea and membranous dysmenorrhea. So when I say spasmodic dysmenorrhea, wherein a woman develops pain with the onset of periods, lasting for about 2 days, 2 to 3 days, and then it regresses on its own. And most of the time, it is physiological, meaning there is no underlying significant cause that could be the factor which is causing this pain during periods, and it is normal. So, this is mainly because, especially seen in those women who regularly ovulate, meaning those who regularly produce an egg, are known to experience a spasmodic dysmenorrhea. In fact, it is a good sign that is ovulating. Some might be more sensitive to the pain, some may not be. So the pain threshold also depends on the severity of which a woman experiences. So this is because once the ovulation happens in a woman, there is release of certain prostaglandins, and these prostaglandins will cause contraction of the uterine musculature at the time of periods, and this is what presents as pain during periods. So once with the cessation of period, it goes off. Most of the time for spasmodic dysmenorrhea, treatment may not be necessary, but if it becomes intractable where doing her day-to-day activities it is affecting, or within a simple home therapies it is not coming down, that's when she might require a medical therapy. So I'll come to it, what are the different types of medical therapy. Then there is second type of dysmenorrhea called congestive dysmenorrhea, where it starts before the onset of periods. Suppose a day prior, or some people it may be at least a week prior to the onset of periods, and it reduces with the onset of periods. And this kind of dysmenorrhea is what is worrisome. So the various factors, and most common cause for a congestive dysmenorrhea is usually endometriosis. In case of endometriosis, the small bits of the endometrium, which is supposed to be shedded off during every period, can go in the reverse direction and start growing within the pelvic cavity, on the tubes, on the ovaries, and as and when she bleeds every cycle, those implants might also start bleeding simultaneously, causing severe pain. So in case of congestive dysmenorrhea, we should always go in detail and evaluate if there are any other causes. Sometimes a woman can also have severe spasmodic in case of multiple congestive kind of thing, or sometimes even spasmodic, those who present with multiple fibroids, or if there is a long fibroid polyp or a big fibroid polyp within the endometrial cavity. So whenever the pain is associated with increased menstrual blood flow, that's when we need to look at for retrospectively go back and identify if there are any other causes which is causing this. Some of the factors which is causing severe form of pain during periods, also called dysmenorrhea, can have an impact on the fertility potential of a woman. Like in case, as I told you, for endometriosis, or in those who have multiple fibroids. So that can have an impact on the fertility and needs to be evaluated and treated as early as possible. Then there is third type of dysmenorrhea called as membranous dysmenorrhea, wherein it is associated with, starts with the onset of periods, severe pain, the entire endometrium, that is the inner lining of the uterus, gets shedded off as a single cast, and once that is done, the bleeding stops. So this is called membranous dysmenorrhea. This is one of the very rarest form of dysmenorrheas, and it is usually because of certain significant hormonal changes, especially when a woman if somebody has taken pills to postpone her cycles, or not got periods for a long time and taken a withdrawal progesterone pills for about 10 to 15 days to get her periods. So mainly because of excessive hormonal imbalances or hormonal therapies, one can notice this kind of dysmenorrhea, and it is a rare phenomenon. So there are various treatments available for different types of pain during periods. First, as I told you, first we need to identify what is the cause, whether it is a normal phenomenon or if there is any underlying abnormalities which is leading to this severe pain. If it is a normal one, Then, simple therapies like proper counseling, making the patient understand that it could be a normal thing because she's ovulating, can experience this pain, and getting herself involved in other activities so that her concentration towards the pain is reduced. And certain home remedies like using a hot water bag or taking herbal tea, performing yoga in the perimenstrual and before the onset of periods, all these things can reduce the intensity of the pain when it is physiological. Suppose if there is any underlying pathologies, then definitely only by correcting those things the pain can be reduced. In spite of all these things, if the patient is still having pain, then we need certain medical therapies like using NSAIDs or painkillers, or only for about 1 to 2 days to bring down the pain. And I see many people coming with the myth that taking this painkillers might affect her fertility, but no, because it is given only for a shorter period, about 1 to 2 days. It does not have much side effects, but again, it should not be repeated very frequently. And then even if that is not, then we need to go with OC pills. In case of endometriosis, we can use a drug called Denogest. Like these various options are available. Certain home remedies also one can do it, like going on of keeping hot water bag, drinking herbal teas, consuming more of vitamin C rich diets like berries, strawberries, then having more of lemon in their diet, and having a very balanced meal, especially during the time of periods, not to go for too much of avoid oily foods, a good protein filled diet to be consumed, and more of vegetables, especially green leafy vegetables, to be increased in their diet. So all these things along with proper counseling will definitely help a woman to fight over the pain during her periods. And it is not something that one should really be worried or scared about the pain. It again, as I told you, it can be normal also, it can be abnormal also. In case anything like that, one has to consult a gynecologist, get herself evaluated and see if there is any abnormalities, and then can go with the treatment accordingly. Thank you.